So I will just jump in and dive into what we're going to talk about today. I'd like to sort of go back a year, a year ago, if you will, almost a year ago. COVID-19 hit the entire nonprofit community in ways that we didn't know we were going to get hit. And it did bring some level of I guess you would call it sort of trying to figure out how to support those in need. And so it brought together our community in ways that we hadn't seen before. One of those ways is through our Groceries for Good program. In addition, we were able to still continue our programs here in San Diego throughout the 2020 year. So a 2020 recap for you here. Our Groceries for Good, we've delivered nearly 1,000 grocery bundles throughout San Diego County to those who have been most in need. This is thanks to the Padres Foundation, Padres Pedal the Cause, U.S. Bank, and Bonds. And we're just very, very supportive of all of those who have partnered together. Our screening and diagnostics program, we've provided over 100 mammograms, breast ultrasounds, biopsies, and MRIs through our partner clinics here in San Diego. We've helped over 200 individuals who have needed financial support through this pandemic. And also we have really stayed on track and continue to fundraise, and that's really to thanks to those who are on this call today. In addition, our national programs that reached San Diego, we've helped 78 individuals with financial assistance. And in addition to that, we've taken 150 calls throughout San Diego for those who are really looking for support, guidance, and really just an ear to listen. And so we'll talk more about our national programs later today. But 2020, although it was a tough year, we really came out very, very strong. Next slide, please. So I'm going to pass the floor over to Lisa Barraza, one of our recipients and just a good friend of ours. Lisa, would you like to share your story a little bit with our group? Okay, looks like we might be having some difficulties getting Lisa. We will come back to this slide. I will talk a little bit more sort of about exactly what has occurred with COVID-19 and our transition, which I'm sure many of you are very interested in learning about. So I've talked a little bit about the changes and opportunities that have come about. Komen in general, but also many nonprofits throughout the United States have been hit extremely hard during this pandemic. And one of the ways we have been hit very hard is through our campaigns or fundraising. You know, when you get together 10,000 people in Balboa Park every year and you're no longer able to do that, you're going to see the impact of that. And one of the early moves during this pandemic that our national organization came together and announced a transition. This transition is bringing together over 60 chapters and affiliates throughout the United States into one Komen. So what does that look like? That looks like we're mission-driven, patient-focused, we have a local footprint and a national presence. To many, you're not going to see that much of a difference, but we do want to dive in and share exactly what that's going to look like and really the purpose of why we have transitioned to one Komen. We really want to get closer to patients. And in many ways, our chapters sort of created boundaries for us where if folks were outside those boundaries, they were unable to receive services from us. And so one of the big moves that we have made and has been very exciting is really this investment into our mission and exactly how we're going to reach patients. I can tell you that we have expanded our mission staff exponentially. We have really created a space for us to come together and collaborate. And you will see that in some of the things that we talk about later in this presentation. We're continuing to do direct support here in San Diego. However, it will look different. We will talk about our programs here in San Diego and throughout the United States towards the end of this presentation. But our helpline and our treatment assistance program, which are two resources that are available to not only San Diegans, but all of those throughout the United States. And something that you may notice, because we are all in our own spaces, which I'm sure you are too, is once the COVID vaccines have been given, we are going to continue to be remote. So we will be here locally as a team, but we will be working from our offices at home and throughout the United States. So we will see a reduction in a lot of our operating costs and a lot of savings throughout. And then finally, the shift that I talked about from individual chapters to one organization really, and the purpose is to serve communities and cities that we have not served in the past. And now I'd like to introduce Megan Klink, our Regional Vice President of the West, to share a bit about some of the exciting things that are happening here in the West. Megan?
Thanks so much, Meredith, and good morning, everybody. Just want to thank you all for taking time out of your busy days for joining this town hall. And it just says a lot about how much you care about the mission of Komen and the work that the San Diego affiliate has been doing in this community for 30 years. And I really cannot say enough good things about Meredith, Leah, Francisco, everybody on the San Diego team who we see here today or not. Really tremendous impact that you all have made, and it's exciting. So for me, I am the Regional Vice President of the West, which is a new role for me under One Komen. I joined the Komen team in 2018 as the CEO for the Orange County affiliate. And it is, as Meredith was saying, incredibly exciting and also a huge opportunity to make an impact as we see Orange County, San Diego, LA, and beyond actually for the first time really being able to work together. And we'll talk a little bit more about that in a moment, but I just wanted to note, because as Meredith knows, I'm very positive. I believe in what we're doing, but just say that this transition has been really challenging, and I think if we pretend that it hasn't been, then that's not being real, and that we are going to see, especially in affiliates like San Diego, like Orange County, where we have such robust local mission delivery, it's going to feel like a contraction in service for a bit of time, and because in some ways it is. But I think the way that we look at this is that first of all, we have to think long term, and how can we leverage our strengths and what is needed most of all in the community for long-term sustainable impact. And that is exactly the process that we're in. And so I just want to again say thank you all so much, because we could not do this without you. And we're going to continue to need you to stick by Komen's side and by this team's side as we move through this transition and really build what we believe is that next step for the work that needs to happen. And so I know that Meredith's going to talk about this in a little bit more detail, but really what I want to share, if we can go to the next slide, are what those key mission drivers will be that we're using as the foundation. And this is, again, nothing that you haven't heard or seen. We're not radically transforming how we do this work. So certainly research will continue to be the cornerstone of the work that we do, right? This is how we're going to get to a cure. And in San Diego, this is particularly important. It's a biotech hub across the country. So really know that you're all doing some exciting things around research. And then advocacy. This is one place where, at least in California, we have always worked together, and we understand that changes at the policy level are critically important. And what's incredible is that this is our we have even bigger opportunities now around advocacy at both state and the federal level to tap into our survivor network. Any of you on this town hall are survivors. We need you and our thrivers and even our caregivers, because this is where change is going to happen at a systemic level. And so thank you so much for that. That's going to continue to be a huge part of the work that we do. And then if we look at this umbrella of community health, which I know Meredith's going to get into, but this is where we're going to be able to see all that local support for residents in our communities, regardless of whether or not we have local staff on the ground in those areas. And it's really that continuum of care from the minute they call the helpline, getting them into treatment, paying for treatment if needed, and beyond. And so I think with that, I'm going to turn it back over to Meredith, and just thanks so much for having me here today.
Thank you, Megan. Appreciate you being here and sharing with our team, and really just getting to know some of our folks here in San Diego. And we will, at the end of this presentation, have our contact information, and also feel free to connect with us, and Megan is accessible with any questions that you might have. So for many of you, you know what Komen is about and what we have been about for over 4 decades. Research and science is really, you know, as Megan said, the cornerstone of what we do and how we do our work. We have some of the most amazing doctors on our staff, and I can tell you that since coming together as one Komen, as I mentioned earlier, I have seen our mission staff just grow exponentially. And this is really the area that we are really looking to do the most work in. So you will see and you will hear in later town halls a little bit more in depth about what we're doing with our research. And I know many of you on the call may be advocates in science, so I thank you for bringing the voice that's really, really critical and needed to exactly how we do our work and what research and science work we are doing here in San Diego, because we, you know, are a big hub, but also throughout the United States. The next slide, please, Leah. So our research priorities. Some of you may be familiar with this and others may not. But our research has been focused on several areas, and this is really our focus in 2021 and moving forward. Number 1 is metastatic and aggressive breast cancers. I can tell you, when you talk to researchers and you start asking questions about, you know, what is going on with breast cancers, and what are these aggressive forms, and, you know, how are we doing the research? They can tell you that there's a lot that they know about breast cancers and much they do not understand. And so really our funding is really to develop effective therapies to treat, prevent, and cure many forms of breast cancer, but especially metastatic and those that are the most aggressive. Second is eliminating breast cancer disparities. This is something that really is top of mind for Komen. Right now we are throughout 12 cities that have been the hardest hit. And really our interventions and methods and our testing tools are really to address these disparities from a system-wide global perspective, I guess if you will. So we have an entire team who's really focused on this piece. And then finally, igniting big data. So what does this mean? It means, you know, we have to have more data to really understand breast cancer. And so we have an entire team that really is focused specifically on this piece of what we do. So our research investment, we are now at 1.1 billion that we have invested in research grants and in clinical trials. So more than 450 new research products supporting Komen's goals, more than 120 new therapies, and more than half of those are focused on metastatic breast cancer, and more than 100 new strategies to reduce breast cancer disparities. So really this is what we're focused on, and this is what's in our Komen's research pipeline. We will have access to our very own doctor here in San Diego who is part of this mission team, Dr. Krista Smith, and we'll have her information and a slide up. But she'll share in later town halls exactly, do more of a deep dive of some of the research projects we're doing. And then second is our advocacy and public policy. So really our advocacy and public policy, I think many of you on the call have participated at the local level and also at the state level. We have really been some of the most, the best advocates throughout the United States. And so San Diego should be very proud of the work that we have accomplished over the last 25 years. And really that work has come together in collaboration with many other Komen affiliates throughout California. But we have done some really great work. I invite you to become an advocacy ambassador for Komen. Reach out to us, find out how you can become an ambassador. And really the work that we need to do is here at the local level and state level, and then at the federal level. But we invite you to be to participate in this, and we have lots of room for you to join us and do this work. And then our community health. So this is where Megan was talking about some of the changes and what this is going to feel like and look like. Moving forward, we will have the following services for our community health available in San Diego. The first is our treatment assistance program. This program is designed to help those who need financial support and help. Komen, for the last 25 years in San Diego, has been a very large funder of grants, community grants. In just the last 5 years, we have really recognized the need to do more in-house support and really getting closer to those patients. And so we made that first step by bringing in our screening and diagnostics program. I can tell you that that program is being replicated right now at the national level, and it is being rolled out of Dallas. And I'm hoping that we can be the second city because we really are the pioneers behind the screening and diagnostics program. So we are hoping that we can jump back on board this year and make those dollars available as we've had in our community before. Our treatment assistance program, we've had something very similar here in San Diego. It's been called our financial assistance program. And we have supported patients who need help with rent, food, transportation, childcare, co-pays, medication. We have really been at the forefront of supporting those needs through community grants. As we move to a national model, we will no longer be offering community grants here in San Diego. But what we will be looking forward to is providing community support in different ways and really becoming more creative in the way that we do those. The second piece is our helpline. I talked briefly about this at the beginning of the presentation, but really this is our customer service line, and folks call from all over the United States, and they get a live person who is with Komen, and really this is to answer any types of questions, whether it be a caregiver, someone who does not have access to medical professionals, or who just needs someone to listen. And so I have a quote here from one of the callers in our area, and this person said, "You have been so sweet and I really appreciate that. Thank you so much for being there and listening. I feel a lot better about this." We continue to connect with patients. We get emails weekly from patients needing support and help and services. And so we're still here on the ground to provide those services and help. And then our helpline also directs patients all over the United States into their community and exactly what kind of support there is and what type of help they're looking for. Third, I spoke about research. Still, it is the cornerstone of Susan G. Komen. And then fourth, our advocacy work, which I hope that many of you will become more intimately involved with if that's something that you can do. Next slide, please. Okay, I'm going to turn it back over to Leah now to talk about some of our upcoming events and things that we have planned for 2021. Leah?
Hi, so I'm actually going to pause for this slide, and I would like to introduce Lisa Bratza. She was a recipient of some Komen services last year. We were going to highlight her earlier in the presentation, and she was able to join us. So Lisa, I want to turn it over to you.
Hi, good morning, everyone. First of all, I just want to say thank you to Susan G. Komen for inviting me here to speak a little bit. I was diagnosed with breast cancer in 2017 and went through chemo, surgery, radiation. But I just want to let everybody know that all the resources that Susan G. Komen helped me with were amazing. From the very beginning, I didn't know where to turn. They gave me resources such as Mama's Kitchen, which would deliver food for people going through chemo. They helped me with, as she said earlier, paying my rent, helping me to pay my rent, resources for just money in general. And then this past time, I'm sorry, when my chemo came back, I know that's not the right way to say it, but anyway, they helped me, with the Padres, they were bringing food to the door for me. They still are. And yeah, so I just want to say thank you and let you know how important it really is to get your mammograms, which Susan G. Komen helps with, free mammograms for everyone. And I think it's awesome.
Well, thank you for being here, Lisa. We appreciate your time.
Thank you.
Thank you, Lisa. It's good to hear your voice.
Thanks. Bye. Take care.
So next, we want to cover and share some upcoming events that we have for 2021. We're going to continue with our Groceries for Good, the collaboration with Padres Pedal the Cause, the Padres Foundation, and other local partners to continue providing free groceries to cancer patients so they don't have to expose themselves in their immunocompromised state to go out and get just the necessities of life. Additionally, in May, we're going to have our Southern California fundraising event where we are joining up with LA County and Orange County to put on a comedy night with headliners Tiffany Haddish and Tig Notaro. So stay tuned for more information on that. We'll be hopefully getting that out so everybody can register or sign up for notifications very soon. And we're going to bring back our Dine Out for the Cure event this fall. We're going to adhere to all state and local guidelines, so it could possibly be a hybrid type of event, but we're definitely going to continue partnering with our community restaurants and cafes to deliver this exciting event for everyone in our community. Additionally, we're going to bring back our mammogram event where we partner with the San Diego Padres and the Padres Foundation to provide mammograms on that event down at Petco Park. So be on the lookout for more information on that as well, additionally with some volunteer opportunities. And then, as always, our signature event, the Race for the Cure, November 7th. And just like with everything else, we're going to continue to adhere to any state and local guidelines on events if we can be in person. But right now it's scheduled for virtually, and we'll continue to plan for that until we know more information. And then looking forward as well, we want to be forward facing in the community and be open to everyone. So we're going to continue to have these town halls every quarter. These are the dates that you can mark your calendars for, and then we will be sending out registrations with the links so you can save those in your calendars and just stay up to date on everything that we have going on. Something that we'd like to do in our town halls is put a spotlight on a community partner. This quarter, we're spotlighting FanView. which is a new partnership that we're moving forward with. And FanView is a platform to share photos and connect with other Komen champions, primarily here in Southern California. So we'll kick off with a San Diego, but we're hoping to have this become a national program. So we're working hard with the developers on that. And this is a way to share any of your experiences with other people, very similar to if you were going to be on a platform like Snapchat or Instagram, where you would tag something that, like an event that you were at, it'd be very similar. So say you're going to be at the Komen Comedy Night, where you can look through everyone else's photos and connect with them as they're sharing photos in real time. And then also this allows you to purchase customized Komen gear, as you can see here. We've got our amazing executive director in this awesome, really fun, bright pink kind of athletic gear shirt, which is Komen branded, and it has an RFID, which allows you to connect directly to the FanView Komen page. So you can scan that with your phone, and then be able to upload any of your photos in your phone directly to the Komen page. So it's really fun. The link for it is here, and we'll share this with you afterwards so you can check it out. And we're really excited to partner with FanView.
Leah, can you share about the custom text?
Oh, yes. So with these shirts, we are adding custom text to, as part of your checkout experience. You can either put a team name, you're walking in memory of someone, or if you just wanted to put your name on your shirt, you can put anything that you want on it. There will be a couple of different locations on the shirt, so you can either put it on your sleeve, I believe on your shoulder, and then possibly also on your back. So there's a couple of different spots that you'll be able to customize this. So if you want to get your team together and order these shirts, we'll be able to put your team name so everybody can recognize. We have pink, I believe white and black shirts, and then we've also got a cap. So very excited about those options, and everybody will be wearing those this year. And now I would like to hand the floor over to Marilee.
Hello there, good morning, and big thanks to Meredith, Megan, Lisa, you two, Leah, and everyone involved who helped put together this very first town hall for Komen and what will be our future going forward. So as many people have already said today, it's no doubt that so many familiar things have changed due to COVID for the past year. But what I really am thankful for is the fact that we do have these platforms that creatively help keep us connected, and more than ever, that is so very important. So the messages and everything that you've been able to provide today is really what's going to catapult us to the future and help keep Komen as successful as possible. So my current role has been board chair for 2 years. It's been a wonderful experience, and I'm so thankful I'll always have had this opportunity to be an integral part of this organization. But it all really started back in 2012 when I was diagnosed with breast cancer. And from the very beginning after that diagnosis, I just felt so impelled to be able to move forward, to be involved with the Komen organization. So starting out as a volunteer, a top fundraiser, and a board member for the last several years have really made me feel so fortunate and have the opportunity to give back to women, men, and their families who really need this critical services and support during their breast cancer journey. So I know that if you're on this call today, you have felt led to by the impact of this critical mission, that we are so thankful for your interest and support as well. As we forge forward into some uncharted territory, we invite you, all of you, to join us, to be that integral part of change. And as I said before, COVID has caused so many changes in our world, but it can't change our passion, it can't change our dedication, and it will never change our vision for a world without breast cancer. So thank you so very much.
Thank you, Marilee. We appreciate you. So now we'll be answering any questions that we haven't already covered in our presentation. So if you have any questions, please feel free to put them in the chat box, and we will connect and check in with Francisco now to see if we do.
Hi, everyone. So one question that we got before this event was when we thought we might be able to do in-person events again. So we wanted to address that. And I think, like all of you, our team is really looking forward to a point where we can all gather again in person, because we really know how important that sense of community is to everyone here in San Diego and to our breast cancer community. And I can tell you that we're continuing to monitor the COVID situation very closely and are following all the most up-to-date guidance provided by our state and local public health experts. And like Leah mentioned, while the race is currently planned as a virtual event in November, we'll certainly be keeping an eye out for any opportunities to host a portion of that as an in-person event, if it's safe to do so. We just wanted to address that question because we know we've been getting that a lot. And we'll continue to be monitoring the chat. I see a question about wanting to get this presentation to show their teammates from Cheryl Ann Cook. And the answer to that is yes, we will be sharing this after the event. It's being recorded. Okay, we have a question from Shannon asking Meredith, what is the plan to let the local community clinics know about how they can refer patients to Komen for support services?
So we have been in touch with our community clinics who have been providing screening and diagnostics throughout San Diego. And we've been in touch with them since the fall regarding the changes to Komen and when in coming to our transition. What will be happening moving forward is that once we are able to get the screening and diagnostics program up and running from a national level, then we will reach back out to our clinics and let them know. But they have been given information, and I've been in touch with many of these clinics just in the last couple of weeks regarding exactly what we're doing here in San Diego and how we can continue to support their patients.
So we have a question from Anna Lilia asking if the Komen services provided through the Jewish Family Service and Mama's Kitchen will, if they'll still be available.
So our community grants will be ending March 31st of 2021. We will revisit how we are doing community grants as we are here in San Diego. But moving forward after April 1st, our community grants that where we have been providing those services with some of our partners will not happen after April 1st. And like I said, we will monitor the situation and we will try to see how we can continue to support many of these wonderful organizations such as JFS and their programs and services.
We have another question from Shannon about how patients can access the grocery delivery program.
That's a great question. Thanks, Shannon. You can access our delivery program by reaching out to Leah. She will get you in touch with our folks over at Padres Pedal the Cause who are continuing to take patients in. We do have limited funding. We started this program back in May of 2020, and we have funding until the end of February. If you're interested in making a donation to this program, please reach out to Leah. We will get you that information so that you can invest in this program as we still see a need for it in the coming months.
I just wanted to jump in and let everyone know we're happy to share our contact information for everybody that is located in the San Diego area here on this slide. And this information, as I said earlier, will be shared with everyone afterwards. We'll have the presentation and the recording of the presentation, so you can get all of the information and share it with whoever you would like.
If anyone has any more questions, we encourage you to add it to the chat box. We're very happy to answer your questions.
Okay, well, if anyone has any further questions after this presentation, as we mentioned, this presentation will be made available to you to share with your team members, with anybody in your family and friends in your circle. So we will make sure to get this out to you. Be on the lookout for an email from Leah. And if you have any questions at all, please email us. We're happy to connect with you. We're happy to jump on a call with you, and we want to be made available. Myself, Marilee, Leah, Francisco, the entire Komen San Diego team, and all of our friends in the West region are also happy to answer any questions, like Megan. So thank you very, very much for joining today and supporting our mission to end breast cancer. We really appreciate each and every one of you and the work that we're doing here in the community. So we look forward to seeing you in a few months for our next town hall. We will be focusing each town hall on a specific subject. And then finally, if anybody in the chat box would like some masks, we have some really nice pink masks made by Marla Hope Designs. And we do have those available to our patients. So please, if you would like a few masks, we'd love to get those to you. So put it in the chat box, your email address, or send us an email after this presentation, and we'll make sure to get those over to you. So in that, I guess we will close out and thank everyone for being here today, and thank you to all our presenters. And we really look forward to seeing you soon.